Okay, you can go ahead.
Okay, great. Hi, good afternoon, everyone. I'm Desh Nepal with Australia section in GIM, doing my presentation here from the Capstone project from Kinetic 3, needs assessment for curriculum and medical era education during MS3 and MS4. Dr. Kaura also helped me with this, and my mentor is Dr. Jeffrey Lam, and I want to start by saying my appreciation for all the support and guidance that Dr. Lamb offered to me. Just a background, to R is human. Unfortunately, like in our medical practice also, we make errors, and those errors have significant impacts on the patient and families. Uh, Institute of Medicine, IOM, first published its report in 1999, where they suggested the annual deaths because of medical error between 44,000 to 98,000 per year. More recent estimates, they've been as high as 400,000 deaths per year. That's certainly a significant impact on patients and their families. But also important to understand is such errors have a tremendous adverse effect on the care providers as well. Various adverse emotions like guilt, shame, anxiety, fear, and depressions have been noted amongst these care providers after they've made some errors. Not just that, it oftentimes leads to medical legal consequences that in turn further exacerbates the various adverse emotions. So, for the sake of both the patients and their family, and also for the better care experience of the care provider, we should be thinking about how we can minimize those like medical error that can occur. And one of such ways is to educate future physicians during medical school by on the topic of medical error. So fundamentally, we are looking to have a curriculum on education of medical errors during clinical years, that's MS3 and MS4. We hope such a curriculum would help recognize and would help future physicians help recognize and minimize errors during their clinical practice, but also like when error does occur, help them build character traits to handle such situations more effectively. So for any curriculum build-up, the first step is the general need assessment. AAMC has outlined the patient safety skills required while entering into the residency. Likewise, the World Health Organization has outlined a curriculum guide for patient safety education in medical school. So despite this general need assessment by both AMC and the World Health Organization, the curriculum on medical era during medical school is non-existent. The standard curriculum is not there. So objective of our current project is the second step of the curriculum build-up is the targeted need assessment. And because our goal is to build such curriculum here at MCW main campus, we want to be focused on our targeted need assessment for here at MCW campus. So methods used for this targeted needs assessment is a survey with the following aim. Number one, identify the need of such curriculum and how best to offer such curriculum. Number two, how identify any barriers, noting like MCW already offers more than 200 curriculums to various students. So we need to make sure this is not another statistics of 201 curriculum out there that students need to choose and pick up from. And number three, identify any perceived character traits such education will help build amongst the learners. For the purpose of this survey, my primary stakeholders are medical students, MS4. Even though both MS3 and MS4 are our target for curriculum, but for the survey, we focus on MS4 because they can give us more meaningful information on their experience, both as a MS3 years as well as MS4 years. Likewise, clerks, directors, and course directors are our additional stakeholders. those are primary stakeholders because they will be directly in charge of the hours of medical students. Additional stakeholders are program directors because the students, when they enter into residency and are really going into their clinical practice, would be the one to first witness such errors when they do make such errors, as well as to see the impact of such errors on those care providers. This project was IRB approved for the as well. So results, I've summarized in the four different topics. One, the need for, before I go into the results, CD stands for course directors and clerkship directors. PD stands for program directors. MS stands for MS Medical Student Year 4. Amongst the clerkship directors, course directors, I had total of 41% of the clerkship director responded to the survey. Amongst the program directors, I had 21% respond to the survey, and amongst the medical students, I had 16% respond to the survey. So for the need for such curriculum, all the clerkship director who responded said there is such need for such curriculum. Likewise, all the program directors who responded suggested the need for such curriculum. Amongst the medical students, 82% of the respondents said there is need for such curriculum. And the second question was, to whom should this be offered? Should this be offered as an elective or to all the students? And amongst the clerkship directors, all the respondents suggested it's best to offer such curriculum to all the students. All the students would benefit by such curriculum. Amongst the program directors, 66% suggested all the students would benefit by such curriculum, whereas 33% suggested this should be offered as an elective. Amongst the medical students, of all these respondents, 95%, all those who said yes, there is need for such curriculum, 95% of those students said all these students would benefit by this education rather than as an elective. The second question that we're trying to answer as a part of need assessment was, should this be offered to MS 3-year or MS 4 or both? Amongst the clerkship directors, 25% of them said it's best to offer mostly for the MS 3 years, whereas 75% suggested for both MS 3 and MS 4 years. Among the program director who responded, 50% suggested for MS 3 years and 50% suggested for MS 4 years. Among those who suggested clinical year is the right time for such education. And amongst the medical student, 22% each selected MS 3 and MS 4 years, whereas 56% suggested such curriculum should be offered for both third year and fourth year. And regarding the knowledge on reporting error, clerkship directors perceived 57% of the clerkship directors perceived the students do not know how to report errors, whereas among the program directors, 33% of the program directors felt residents do not, when they start the residency, fully understand the importance of reporting errors. Amongst the medical students, 76% of the respondents did not know how to report errors. And regarding the question on character traits, amongst all the respondents, honesty and humility were the common, most top choices, and hence are underlined here. Amongst the clerkship directors, they also thought judgment, bravery, perseverance, and trustworthiness are additional character traits that would be added by such an education. Likewise, medical students thought those qualities, in addition, perspective, will be added amongst the learners, whereas program directors thought forgiveness is another top choices amongst the program directors for the kind of character traits such learners would inherit over time. Some other additional character traits that were opted were by the respondents were kindness and compassion. So overall, my conclusion of this survey for the needs assessment, the survey highlights the need for a structured curriculum on medical era during clinical years. Number two, majority of the stakeholders feel all the students benefit from such educations as against the elective, And it makes sense because students will be going into various clinical practice, and they're bound to make errors like in all the areas they may work on. And number three, majority of the respondents opted for both the medic third year and fourth year as a time when we should offer such education, and perhaps and they also, like clerks of directors suggested, 1 hour per month is the available time for this curriculum. So that may give us an opportunity to form a longitudinal format of curriculum here. And such education will help build various character traits. Humility and honesty were the top choices. My entrepreneur mindset that I learned from this kinetic curriculum, faculty development curriculum amongst the curiosity. What I feel is constant interaction with the learners and self-experience is what drives my curiosity. And the connections, individual connections that are made are extremely valuable, and amongst and regarding creating value, meaningful changes in medical education that impacts positively to both patients and care providers is the value I want to build from this curriculum here. And these are the references that I use for this. And I would like to thank you once again for all the